one of our more challenging and sorry, it's not a beautiful picture. I hope there aren't too many family members here. But anyway, this is a woman who had this ulcer on her left lower leg for 7 years. When we saw her for the first time when she was 65 years old, she had multiple procedures done. She had multiple dives in hyperbaric chambers. She had the maximum number of allografts. And actually, when we saw her, she had her peripheral vascular arterial tree, actually angioplasty, thinking anything to improve blood flow should help her. She was needing to change her dressing every day because of the amount of drainage she had from it. Actually, she had a very doting husband who helped her. And then she was diagnosed with lymphocytic lymphoma and actually had to undergo chemo at the same time. So she came to us in October of 2013. This picture is in, I think, December of 2013. And it took us that long to coordinate with her cardiologist about if we found a saphenous vein that was refluxing. I wanted to be sure that he didn't think he'd need that to revascularize her leg someday, because having been a heart surgeon, I know that saphenous veins are good conduits or pipelines to put in other places. And then I had to talk with her oncologist about, well, would you really advise this kind of procedure in someone undergoing active chemotherapy? And after we had all those conversations, she and her husband really were very keen on trying anything that might help, and her physicians agreed, since she had struggled with it for so long. And actually, it healed in less than 6 months from our procedure. We did the procedure in December, which is just before the day of the photograph is when we did her venous procedure. And 6 months later, she was no longer going to wound care. She had no open area, even though it's not a pretty angle on the right-hand frame. It is a healed angle, and she was ever so grateful. I think because of time, I don't know, this is her other leg. She developed a small ulcer over there as well. She had venous reflux there, and once her husband saw in February, he was just so relieved that he didn't have to do the dressings every day. He said, you really need to do this. And so he actually did the surgery or the procedure on her right leg as well.